So thank you for tuning in to today's Health Philanthropy Summit. And again, it's underwritten and produced by Health Giving, and it's done in partnership with the Ohio Association of Healthcare Philanthropy. It is a great privilege to welcome you to our expert question and answer session. If you've been in fundraising for a while or even a short time, you already know how important major donors and principal gift donors are. Many professionals will say that 80 to 90% of the funding during our campaigns or during our annual pushes come from about 10 to 20% of our donors, our major donors and our principal donors. And as we progress further into the end of 2021, we know that there'll still be some unprecedented events and some things that'll cause us to reorganize or re-strategize our approaches to large and major donors. The pandemic has changed a lot of our expectations and some of the capabilities when it comes to major gift and principal gift fundraising. It's a real privilege for us to welcome someone who has had great success with principal and major gift fundraising these past several months. Larissa Trinder is the Director of Philanthropy and Principal Giving at Children's Hospital of the King's Daughters in Norfolk, Virginia, Hampton Roads area. Right now, CHKD, as it's known, is building a 14-story, $224 million mental health hospital and outpatient center for children. This is an extraordinary facility that's going up on their campus, and it'll open in 2022 with 60 private patient rooms and space for programs that specifically address mental health care for pediatric for children in their region. CHKD's Lighting the Way campaign fundraising goal will open the facility when they hit 60 million. And I'm happy to say that because of some visionary philanthropists and hard work from the staff there, including Larissa and her work, they've already reached 58 million at the time of this taping. Larissa has been very instrumental in making some of these 6 and 7-figure gifts happen. Larissa has been with CHKD for more than 9 years, and she's progressively been promoted, once serving as the Director of Major Gifts, the Director of Corporate Relations, and now the Director of Principal Gifts, the large gifts that she has helped secure. Prior to CHKD, she served as the Director of Development for YWCA Southampton Roads, and she now serves on that organization's board. She's a highly experienced Director of Principal Giving, and she's very good at individual giving and dealing with high net worth individuals, corporate relations, and family foundations, and planned giving. She has a strong community activity and volunteerism and social service, and she's active in cultural arts in addition to healthcare. And she provides the health system's oversight for its arts program, including the commissioning of art to enhance the patient experience. And she recently graduated with a master's in public administration from the Wagner School of Public Service at New York University. She also has a bachelor's of arts from Franklin and Marshall College. Larissa, it's great to have you with us. Thanks for being here.
Thank you. I appreciate it.
Let's jump right in. Can you describe the CHKD Lighting the Way campaign that I talked about and tell me about your organization's current fundraising efforts?
Sure. Thank you. I appreciate being here, and I'm honored to talk a little bit about our principal giving program. So the Lighting the Way campaign was a direct response to our community's assessments that we do as a standalone pediatric facility every couple of years. And it came back multiple times that the mental health crisis for children and young adults was at a level that was something we really needed to look at. So our board in about 2017, I believe, late 2017, decided that, this was an initiative we needed to explore more about. Long story short, they ultimately came back with and supported our ability to go after a certificate of public need, which means that we were given the opportunity to build a 60-patient inpatient facility, 14 floors, as you just beautifully described in that intro. So this is, as you said, a $224 million build. Our campaign goal is a $60 million one. And honestly, it's just even pre-COVID been an amazing opportunity for us because the mental health space was really not one that we had been in. So it gave us the opportunity from a principal giving standpoint to really have a whole new narrative for donors that already had been supporting the health system in the hospital, which has, by the way, been around here since established in 1961. So we are a very beloved facility. It is, as I said earlier, the only standalone in the entire state of Virginia. And so taking on this whole new landscape of mental health was really, frankly, really, really exciting. And I think we really pushed some new energy into our philanthropic community here.
it's, you pointed on this when you planned this before the pandemic. I mean, this was something I sometimes say, Wayne Gretzky said, skate to where the puck is going, not to where it's at. And when you think about your leadership and your organization planning for and wanting to do more for mental health and behavioral health for pediatric and families in the community, that was way before the pandemic. And now the pandemic, I think, has only made more the importance of what you're trying to do. So you started this out, and a lot of the fundraising, the success in fundraising was 2019 and 2020, the height of the pandemic. So how has the CHKD team been able to maintain and build relationships with donors and prospects during these pandemic times? And in what ways are you, second part of that question, in what ways are you continuing to inspire the community to participate and to support and to give to this initiative?
Well, that was a lot of good stuff. So, I think that one of the basic tenets of principal giving is being nimble and innovative and creative in your approach. And having the pandemic was something obviously none of us could have even begun to foresee what that impact was going to be. So we were nervous at first. We really were. We thought, oh my gosh, we're launching this campaign. We've gotten a little bit of cadence in the beginning, and now what are we going to do? And we even kind of set back a little bit of our metrics at that time to sort of, address what we felt were not going to be successful projections for that year. What we found that was really interesting is that we, had an enhanced amount of virtual meetings. We got really kind of creative with our boards, and reaching out to them to talk about different connections that they had in the community to make them feel like they had meaningful engagement. But sort of a secondary kind of interesting outcome was that, you had these CEOs and these high net worth individuals that were home. They were home in their offices. So getting a meeting with them wasn't quite as complex. And not having to deal with going down to their office and being there in person and maybe mitigating an executive assistant or whatever, really kind of made it easier. And in my case, helped me to establish much closer relationships with some of those individuals that have really continued to just help us through the campaign today. But, as you said, I mean, it was really an opportunity to just be creative and to kind of completely pivot our usual way of doing business and think about how we were going to do this. And it also gave the opportunity for us to say, hey, we really didn't need to be doing that event. We've been talking about kind of getting rid of events for many years now, and principal giving and the transactional aspect of that, and, the lack of retention of donors. And this really gave us that opportunity. So we got rid of some that we probably will never do again. And we're able to kind of create new ones that were much more strategic and I think, quantitatively successful.
So Larissa, I have a little bit of a knowledge of your campaign, and I know that, not only did you close one of the first big gifts that really was one of the pace setters in this, you continue to close some of the big gifts that are continuing to create the momentum and allow the campaign to get into a public phase, and now hopefully a closeout and celebration phase. But if I had to ask if there was one, what's been your proudest moment in this campaign to date, whether it was closing a gift or interacting with physician leaders or others? What was that proudest moment? And you can name more than one. You can name more than one.
Yeah, I mean, I think I had one from a donor perspective, and I think I've had one from sort of a patient family perspective, and I could have multiple. But, I think for me, everything about principal giving, and you have been working with us for many years now, and you've talked about this, is relationship based. And I have realized that more than ever in the last few years, how important that is. And so I established some at such a high level of, asking people for such large sums of money. They really require you to explain to them what that impact's going to look like. They want to know more. And so it really gives you the opportunity to not only learn a lot about your subject matter, but also to really understand what that what they want to do and what kind of impacts they want to have. So I think one of my favorite moments was when I was on vacation last summer, sitting on the beach on, a Tuesday afternoon, and I got a text from an 80-year-old donor who said, I have a 7-figure gift to give you. How do you want the money? What's the quickest way I can give you the money? And it struck me as really amusing at the time, because I texted her back, and we have this great relationship. And it just was so amusing to me. I thought, oh my gosh, is this what major gifts has come to? You're texting somebody on the beach on vacation, but that really is what it is. And you're never I don't feel like I'm, and I mean this in a good way, ever really on vacation, because I have established extremely close relationships with my donors and the people that I work with in the community. And so that's really I feel the most important thing. The other part of this was some of the donor families that we've worked with, around mental health has been really difficult, because unlike the main hospital, we're able to get patient families. If a child's going through cancer or a child has dialysis, we're able to kind of mitigate that family and have them tell the story. And that's a little bit harder in the mental health realm due to the confidentiality around it, the stigma that still unfortunately exists. So we have had a couple of young adults come forward and say, hey, I want to be a part of that. And then they have spoken at different events, or they've formed peer leadership groups within their school. There's kind of two young women in particular I'm sort of thinking of in my head, but there's many more. And that has really been reinforcing to me, because it's why we're doing this. And that sounds a little wax poetic, but it's true. It's why we're doing this. And we want to empower these young people to have a voice and to, be a part of this solution and this building that we're building and the programs that are going to be in it. So, we've seen one of the young ladies has the highest anxiety I'd ever seen prior to, got into our program, and then now goes out and publicly speaks and has learned that that's a way for her to give back. So there's all these sort of, and those then get incorporated into my narrative very organically when I'm speaking to my donors and my philanthropic community. So that's been a very rewarding aspect of this too.
Larissa, how important were volunteers and the relationships of leveraging some of the volunteers? I know with the campaign, you had a campaign cabinet, and you had some of the leaders in the Hampton Roads community, the John Lawson, Susan Wynn, the Good family, Frank Patton Jr., and others. How important were they to the work that you were doing, and how have you leveraged those leadership relationships to help with some of these principal and lead gifts in the campaign?
Yeah, that's a fantastic question. And something I've really learned a lot about during the last probably 24 months, that they have been absolutely wonderful. People at that level that want to be on a board, a campaign cabinet, or a board on the hospital, they want to do this service for a reason. And as a result, they want to be utilized. And, I absolutely do not raise this funding by myself. And of course, that we have a whole infrastructure here and a team that obviously helps with different aspects of asking someone for a large gift. But, these partners and these volunteers have been just frankly critical, and something that I've kind of just incorporated into my whole manifest now, because I'll reach out to them all the time. I call, I text and say, hey, do you know so-and-so? Can you call this person? And, they love it. They're like, great. They don't have to, I always tell them, you don't have to ask for the money. I just need you to, help me get in the door with them and explain to them that what we're doing is really important to you. And so that's an extremely critical aspect, I think, of not just running a campaign, but just moving forward in this career, because without those kinds of relationships and doors, you feel like you're just cold calling, or you're the development person calling. And it's really again, I know I sound like a broken record, but it's really relationship driven.
Well, so some of our audience that tune in for this are very experienced gift officers, and some are new, starting out, and some of them aren't even working in major gifts, but that might be something they aspire to do. So if you had a piece of advice that you give to others that you believe would help their major gift fundraising efforts, as they look at future campaigns and as they look at pandemic recovery and this time that we're in right now, what would be your advice to them to help them in their major gift fundraising efforts?
Be assertive and be involved in as many things as you can. Be out there in the community, know what's going on in all different adjacent agencies that may or may not be related to yours. You mentioned my interest in the arts. All of those different kinds of, environments help you to meet people, to understand the culture of the community, to get to know people. It's just a critical thing. Join different organizations, be on boards if you can. All of those things really help you to understand the major players in different communities. And also I think that, really be involved politically to the extent that you understand what's going on with the laws in your state and how they may be affecting funding as it may come down to your organization. And, I never really thought about those things sort of until recently with the mental health piece, because that was such a critical part of our funding early on, and continues to be. But, having some real good understanding of that. And then the other thing I would really say to either young or even current experienced ones, understand how to read your organization's financials. know how to diagnose a financial spreadsheet, just even at a very rudimentary level, so that you can say, here's where they're spending a lot of their money on programs, and here's where they're spending, just because that really can help you to kind of deliver that narrative when you're talking to donors, because they are the ones that particularly I feel at high levels ask those kinds of questions, and they ask sometimes some really tough questions, and I don't know all the answers, and I often will say, you know what, let me check with our CFO or our finance, and I'll come back to them, but be at least prepared somewhat to answer some of that.
Yeah, I think that's great advice. I mean, particularly at the principal gift level, and then the levels that you're dealing with. We often say that philanthropists at that level are like investors, and what do investors like to know? They want to know the impact of their giving, the return on their investment, but they also want to know that they're funding a good business, and they want to know where you're investing your money, what kind of people you're bringing in to lead programs, and the investments you're making. So you're absolutely right on the spreadsheets and understanding, to think of people like they're large investors. They're philanthropic investors that want to return. So they're going to want to know that you're running a good business. And sometimes you share the books, and to be able to be knowledgeable is a good thing.
I like your use of that word, just really quickly, Bill, of the word investment. And I think looking at kind of the nomenclature we use in philanthropy is important as well, because we often talk about a gift, funding, an investment, and they can certainly all be intertwined. But I think that's a really great term for to use with high net worth individuals, because it's speaking their language,
Yeah. So you mentioned art, and I did as well, because I know that that's the passion of yours, and we certainly often talk about the healing power of art, and we know how our hospitals and our clinics and our care areas, if they have bare walls or if they're dull and dreary, they don't represent the healing and the uplifting spirit that we want, and certainly children's hospitals should be whimsical and uplifting and have some great art and some great features. So you have been instrumental in being a champion for this, for knowing that art can lift spirits and affirm lives and provide comfort. And you've really pushed some great initiatives at CHKD and elsewhere in terms of making sure that art is a part of great hospital design, and how donors can be a part of that, and how you can partner with them to create these beautiful spaces or bring in these beautiful art pieces and these installations. So can you tell us a little bit about your promotion and your leadership and your interest in this area?
Sure. This has just been such an exciting part of my position in the last few years. And as you said, I've kind of been doing it for many years, bringing art and creative experience to the children in the hospital. We have a director of patient experience. And so we sort of just started doing this incrementally over the years. As an aside, everything that we're doing with this mental health facility is evidence-based. Which means that everything is backed by science. All the therapeutic modalities that we utilize, everything is science-based. And so for a long time in healthcare settings, the idea of integration of arts was more about, to your point, more about people feeling better. They were in an environment that made them feel a little better. We've been using distractive elements related to art for kids for years so that they could get a port put in the cancer clinic, for example. But, what really started to become interesting probably in the last 5 years is the attention around the data points for the clinical outcomes related to patient experience. And so I started to, just out of my own interest, kind of look into that and see what that really meant. And then I did have a cabinet member, a very astute one, say to me one time, what's the science behind this? Why are you bringing art in? So I'm also extremely fortunate to work in a health system where leadership understands this and believes in my promotion of this for patient experience, and really kind of understands that as part of the whole mental health facility, that the creative expression piece is incredibly critical. The other piece of this that's equally as significant, in addition to the clinical outcomes and the reduction of pain for children and all these other kinds of wonderful data points, is that it's a great philanthropic opportunity. So we've integrated some really significant pieces into the the new mental health hospital, and we have pretty large recognition opportunities attached to them. So we may have a piece of art, I'm making up, that's $20,000, but the recognition is $1 million. And so it's engaged a lot of the art community here as well that have not historically given to healthcare. They know us, they appreciate what we do, but art is their thing. And now that they're sort of seeing what we're doing, those donors have really come out of the woodworks in wonderful ways to kind of support this initiative and are interested in it. Because ultimately, at the end of the day, when this is all said and done, we will be leaving this community with a hospital and a facility that has some beautiful pieces of work. And we're doing a big community outreach component to it as well. The artists are all engaged, and we're gonna have a scan code on each piece of art that kind of describes why they did this for the mental health facility. So it's just yet another entire space that we have untapped for us to sort of raise funding.
Excellent. So Larissa, I think this, this brings our time. I wish we had more time to talk. I know we could continue to ask you questions, and I know you would provide great answers for our audience, but is there anything, kind of a summary question that we're leaving out? Is there anything else that you think needs to be addressed? Again, our audience is thinking about their major gift programs, thinking about their principal gift programs, and now even, because I think you've inspired them, thinking about the creative use of art in their fundraising, and also how that can help design and create beautiful spaces amongst their healing organizations and their hospitals and their facilities. Yeah. Anything we left out? Any parting words of advice?
Well, the one thing that just kind of jumps to mind really is that, principal giving and major giving are not going away. And I think that, whether we have a campaign or not, there's just tremendous opportunity. The arts gave a good example of that, but there's so many other areas that we could be looking at to raise funding for. So it's really how much you intellectually care about different things going on in the hospital, the narrative you can create around that, and the funding opportunities that can come from that. So I would just say to, keep searching and learning more about your organization, because there's definitely things in there that people may not have known, and that the philanthropic community may not know. So it's just, really important to keep learning all the time.
Excellent. Thank you, Larissa. I appreciate your time. It's great to have you here with us, and thanks for taking the time to educate us and share a little bit about your success and continued success as you and CHKD keep going forward for your Lighting the Way campaign.
Thank you so much for having me.